Hi everyone, welcome back to my YouTube channel, and today we are going to talk about anatomical planes. So let's start our topic with introduction. Anatomy is study of structure of human body, and to describe the position and movements of body parts accurately, anatomists use studied reference system. One of the most important of these is concept of anatomical planes. These planes are imaginary flat surfaces that divide the body into different sections, allowing healthcare professionals and students to describe locations, relationship, and movements with precision. Concept of anatomical position. Before understanding anatomical planes, it is essential to know the anatomical position, which serve as a universal reference point. In this position, body is standing upright, feet are together and facing forward. Arms are placed at the sides and palms face forward with thumbs pointing outward. This standard position ensures consistency when describing planes and directions. Major anatomical planes are sagittal plane, frontal plane, transverse plane, and oblique plane. First major anatomical plane is sagittal plane. In the sagittal plane is a vertical plane that divides the body into right and left portions. When it passes exactly through the midline of the body, it is called as mid-sagittal plane or median plane. But when it divides the body into unequal right and left parts, it is called parasagittal plane. Example in practice of sagittal plane are movements such as walking, running, or nodding the head that occur in sagittal plane. Next major anatomical plane is frontal plane, that is also called as coronal plane. Frontal plane is a vertical plane that divides the body into anterior and posterior portion, or we can say vertical plane that divides the body into front and back portion is frontal plane. It runs perpendicular to the sagittal plane. Example in practice of frontal plane are jumping jacks, side lunges, or tilting the head sideways are movements that occur in frontal plane. Next major anatomical plane is transverse plane, that is also called as horizontal plane and axial plane. Transverse plane is a horizontal plane that divides the body into superior and inferior portion. Or we can say a horizontal plane that divides the body in upper and lower portion is called as transverse plane. It runs parallel to the ground when the body is in the anatomical position. Example in practice of major anatomical planes are rotational movements such as twisting the torso or turning the head that occurs in transverse plane. Next anatomical plane is oblique plane. Oblique plane is any plane that divides the body at an angle other than 90 degree to the sagittal plane, frontal plane, or transverse planes. It allows the study of structure that do not align with major planes. Example in practice of oblique plane are MRI scan that often use oblique planes to provide better imaging of certain organs or tissues. Clinical significance of anatomical planes. Understanding anatomical plane is not only important for descriptive purposes but also for practical application in medical imaging, as X-rays, CT scans, and MRIs are often taken in specific planes to visualize internal organs clearly. It has practical application in surgical procedures, as surgeons use planes to plan incision and approaches to internal structures. They have practical implication in physical therapy and sports sciences, as movements and exercises are categorized based on the planes to design training programs effectively. They have clinical significance in communication in healthcare, as anatomical planes allow precise and universal communication between healthcare professionals. Conclusion of this lecture video. Anatomical planes provide a systemic way to describe the human body structure and movement. Sagittal plane, frontal plane, transverse plane, and oblique plane form the foundation of anatomical terminology and clinical practice. Mastery of these concepts is crucial for students, healthcare professionals, and anyone studying human anatomy, as they ensure accuracy in understanding, teaching, and applying anatomical knowledge. And this was all about anatomical planes. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.